Thanks, Ed, and good evening, everybody. Just to put things in context, I do work at the Department of Mental Health, but I'm also a practicing psychiatrist. I see outpatients who are children and adolescents, and when I'm on call, I work in the emergency department and on adult psychiatric units, and in fact, I'm on call right this very second for the Department of Psychiatry. I also want to say for disclosures that I get no money from any pharmaceutical company. I also want to say that even though I work for UVM and I work for DMH, I am not speaking on their behalf today. This is really just my own opinion. I'm not trying to speak for them today. I'm also not politically conservative, and I think a lot of people assume that everybody who's has some concerns about commercialization tends to be on the conservative spectrum. So Ed, the answer to your question, the short answer is definitely yes. My guess is that people don't want me to just spout study after study, so I'm going to kind of I'll be brief. And while I personally don't think that cannabis is inherently the most dangerous substance on earth, I do think that it may be the substance where there is the largest gap between its actual level of harm and its perceived level of harm by the public. And in my view, that makes it more dangerous. One of our primary worries regarding cannabis use has to do with the development of psychotic thinking. And by that, I mean things like paranoia, hallucinations, delusions. I see this, unfortunately, very regularly in my practice, and virtually every single time I'm on call on the adult psychiatric units and in the emergency department. And what I often see are people coming in with something called cannabis-induced psychosis. They come in, they're seen in our emergency department, or they're admitted to our psychiatric units for several days, and their thinking often clears. But since they don't really see that there's any link between the cannabis use and the psychosis, they go back to using, and then generally this cycle tends to repeat itself over and over until one day, even when they stop using cannabis, their brain doesn't bounce back anymore. According to the research, 34% of people who become psychotic while using cannabis convert to having schizophrenia or another psychotic illness which does not require the presence of actively using substances. And cannabis use beats all other drugs in terms of its conversion rate. A large study in Europe calculated that about 12% of first episode psychosis cases would be prevented if youth did not use high-potency cannabis. And in some cities, the rate was as high as 50%. And with psychosis, unfortunately, comes a risk of violence, right? If you're paranoid, if you think people are coming after you, you need to defend yourself. Another emerging sign, as we've already heard, is about suicide, with a major study that came out showing that the risk of suicide attempts is about triple for young cannabis users. There's also strong evidence on the ability of cannabis to impair memory, attention, and other cognitive domains. And as researchers from the RAND Corporation once said, cannabis is a performance-degrading substance. And that doesn't sound like something Vermont needs a whole lot more of right now. One of the main points I want to make tonight is that the evidence for these risks are strong. Like all complex issues in medicine, studies can be inconsistent and they are always flawed. But overall, the data that concludes that cannabis is bad for many people's brains is quite strong. And contrary to what many of you are led to believe, the evidence goes way beyond simple association studies. There are randomized controlled studies, there are animal studies, there are genetic studies, and there are complicated designs that strengthen the case for causality. These are all the same kinds of studies that have helped us determine that broccoli is good for you or that the world is getting warmer. Now, it would be one thing if the cannabis industry was ready to acknowledge these very significant risks, but it doesn't. They dodge, they minimize, they deny, and they dare treat anyone who says anything negative about cannabis as being a prohibitionist suffering from reefer madness. And what that signals to me quite strongly is that the industry simply is not ready for the responsibility that they are asking for. Several decades ago, the tobacco companies told us not to worry, right? It's a plant, after all. And we believed them, and we paid a huge price. More recently, the opiate manufacturers said that their new products weren't addictive. And again, we believed them. And again, we paid a huge price. Now the cannabis industry is here, ready to cash in on the next public health crisis. So I want to acknowledge that there are more issues related to cannabis commercialization than just the health and mental health perspective. But what I really want you all to understand here is I want you to have full awareness that any move forward is being done despite the public health impact, not because of it.